An amiable welcome to everyone. This is your Lecdem channel to enhance your understanding. Today's topic is about AMBU bag resuscitator. This is a picture of AMBU bag resuscitator. The other names of AMBU bag resuscitator are AMBU, which is Artificial Manual Breathing Unit, AMBU bag, Manual Resuscitator, and Self-Inflating bag. Definition: AMBU bag is used to ventilate the patient. AMBU bag is a handheld device used to provide positive pressure ventilation to a patient who is not breathing or whose breathing is not adequate. The device is self-inflating with air, although additional oxygen can be added. Position: one hand to maintain face seal, to provide the head position, to maintain the patency, and other hand for ventilation. The patient is placed in a sniffing position if C-spine is okay. Thumb plus index finger to maintain face seal. Middle finger under the mandibula. Ring and little finger under the edge of mandible. Indications: to provide positive pressure ventilation to patients who are not breathing properly, in case of any failed intubation, for ventilation in the OR, and during CPR. Parts of AMBU bag: non-rebreathing patient valve, intake valve, compressible self-refilling ventilation bag, nipple for oxygen tubing, oxygen reservoir bag, oxygen reservoir, AMBU mask, O2 extension tubing. The standard components are of three parts. Part 1, it has a flexible mask to seal over the patient's face. Part 2 has a filter and a valve to prevent backflow into the bag. Part 3 has a soft bag element which is squeezed to expel air to the patient. Standard components of AMBU bag: bag and valve. So bag and valve combinations can also be attached to an alternative airway adjunct instead of the mask, like it can be attached to endotracheal tube or laryngeal mask airway, and small HME, which is heat moist exchange filter, or bacterial filters can also be used. Bag valve masks come in different sizes. Most type of the device are disposable and therefore single uses, while some other types are designed to be cleaned and reused. Types of manual resuscitator. First, self-inflating bag, also called as AMBU bag. So self-inflating bag fills spontaneously after they are squeezed, pulling O2 or air into the bag. It remains inflated at all times. It can also deliver positive pressure ventilation without a compressed gas source. And the next one is flow inflating bag, also called as anesthesia bag. It fills only when O2 from a compressed source flows into it. It must have a tight face mask seal to inflate, and also uses a flow control valve to regulate pressure inflation. Method of operation: when compressed by the rescuer, the gas is then ideally delivered through a mask and into the patient's trachea, bronchus, and then into the lungs. Squeezing the bag once every 5 to 6 seconds for an adult or once every 3 seconds for an infant or a child provides an adequate respiratory rate. Non-breathing valve closes the expiratory port when the bag is manually squeezed, letting the air inside the bag to pass to the face mask. And during expiration, the bobbin of the valve comes to normal position, letting the expired air to void into the atmosphere. 100% of oxygen can be delivered by AMBU bag by attaching oxygen source and oxygen reservoir. The AMBU bags are available in a capacity of 1200 ml for adults, 500 ml for children, 250 ml for newborns. Purposes: for administering additional oxygen, It is used as a part of CPR when breathing is absent or inadequate, can be used mechanically to ventilate the patient. During CPR, two rescue breaths are given and after a series of 30 chest compression until an advanced airway is placed. Complication: vomiting, aspiration, barotrauma, volutrauma, Mendelssohn syndrome, hypoventilation. Thank you.